Often as academics, we think that we're in charge of the process of generating scientific knowledge. The problem is policymakers and practitioners themselves are generating knowledge, and that knowledge gets lost because it often doesn't turn into scientific knowledge. One way around this loss of knowledge is for scientists and academics, economists like us, and practitioners and policymakers to co-generate the knowledge together from the beginning to decide on the questions that have that beautiful area of overlap between something of great scientific interest and something of great policy impact.
Well, Zambia is a developing country. We have quite a lot of health issues and challenges. The biggest problem is we don't have enough health professionals to provide the service for the whole country. We are experiencing human resource crisis. And the crisis is both in terms of the numbers as well as the skills. But I think the areas severely affected are the lower levels in the rural areas. We were debating what is the way forward. Do we continue investing in the doctors' training, which we knew it was going to take us 40 years before we could get the numbers we need for the country? Meantime, the people are dying. Or shall we invest in the lower level in terms of training community health workers? Now, to answer that on our own as policymakers, without good background in terms of research, that would be very difficult.
The problem is that nobody wants to work in rural communities in sub-Saharan Africa. Typically, somebody who has qualifications which can be used elsewhere stays very little in the communities that they're meant to serve and moves on. So the government of Zambia is now implementing a new strategy. So instead of taking nurses and sending them out to the rural communities, they're trying to do the opposite. They're trying to take a bottom-up strategy where they take people who already informally provide health services in the community, recruit them, take them to a central location, give them basic training, and then post them back to the communities.
So we arrive off the plane and we're called to say, come to the Ministry of Health at 8 a.m. We arrive and there gathered are the Director of Human Resources and a number of people from that directorate and the Director of Public Health and Research and a number of people of that directorate. And they say, this program, you know this program that we've been talking with you about for 3-4 years, it's a go. And it's a go in 2 months.
We collaborated with the Ministry of Health in Zambia to answer a very important question which they had.
How best do we recruit, retain community health workers and make them perform better? Are we looking at a community health worker who is part of the community, does not lose their identity, committed to save the community there? Or are we looking at a health professional in terms of wanting to progress to become a nurse or environmental health technician or a clinic officer or a doctor? So there's that career path.
What's going to happen to them if they now see themselves as part of the civil service? Are they going to lose their connection to the community? Because so much of the purpose of this was to recruit from the community for people to go back to their communities.
We didn't want them to lose their identity as part of the community and the link.
Now, little did he know that this is a question that economists have been pondering about for the last 20 years or so.
So we want to make sure we get research done on it. How do we do that? What do we do? And there we came up with the questions together that ended up becoming this long research program. What are the questions that are of great interest or importance to them, to the policymakers that we were in dialogue with, and could actually resonate and help us uncover some more deeper scientific questions that we were interested in too. And we generated those questions together in that meeting, and yet that meeting never ever could have happened if we hadn't had 4 years of dialogue and trust and building of the enormous relationship and understanding of where the other was coming from, to be able to get to the point where we say, okay, now it's a go and we can find the questions and implement together.
We collaborated with the Ministry of Health to try out 2 alternative recruitment strategies. The ministry was recruiting community health workers in 160 villages. So we chose 80 of these villages randomly. We distributed a recruitment poster that said, come and become a community health worker, help your community. So the mission was clearly that of helping the community. In the other group of 80 villages, we advertised the same position with exactly the same requirement, but with a different mission. And the mission there was build a career in the Ministry of Health. Become a community health worker. This is the first step of the ladder. The applicants who answered to the career poster, they were more likely to be qualified. They had more O-levels, the total score was higher, and they had more O-levels in biology and natural sciences. We followed these applicants from the stage of selection through the training, through them when they finally were deployed on the field in the summer of 2012. And we've been following them for a year now. There is a striking difference in performance. The applicants who answer to the career poster visits 20% more households, although they spend the same time with them. So it's not a quantity at the expense of quality. They visit more and they spend the same amount of time with them. They also do more on other dimensions. Another very important role of the community health worker is that of organizing community meetings to spread information in the community. This could be information about vaccination and the importance of vaccination. It could be information about HIV/AIDS testing. The applicants who answered to our career poster, they also organize 50% more community meetings.
What is coming out of the research is that the best way for us to recruit and retain community health worker is also to provide for the career path, so that they are able to, those who want to upgrade into nurses, clinic officers, doctors and so on, the facility is there for them to progress. Now we have scaled up. We started with one training center, we're opening another one. We are getting them from every corner of the country now. So it's scaled up to cover all the districts in the country.
We can take many lessons for recruiting in the public service in general, not just in Zambia and not just in the health sector. And in particular, what I think these findings show is that giving people a career goal, a professional opportunity, does not come at the expense of their pro-social motivation.
We need researchers, and researchers also need policymakers. Research must be translated into the evidence needed for policymakers to be able to make policy based on evidence.
But our results show that in fact the performance in the field changes as a result of what you emphasized in terms of the mission of the organization at the outset. All that changed were these posters, the way that you advertised this position, and yet it drew in a completely different cadre. A major takeaway actually from both the process and the research results, it's that in fact we can experiment together and we could learn together through a process of structured experimentation.